Super Mommy Not will be producing a year-long series in which we will follow a family and their doctor as they tackle the issue of childhood obesity. Dr. Stacy Wadlington, a licensed clinical psychologist, will help a mother and her daughter learn better coping skills to in turn make healthier choices. I am so excited to be invited into their therapy sessions and to learn from the work they are committed to. There are so many issues that will come out in these sessions. It is a raw look at their life. Today we start with Felicia, the mom, and Dr. Wadlington.
My goal really is to be a better person, so I can empower my daughter to be a better person. I have to be willing to address those little things in me that make me want to rescue her. I have to be able to sit with my discomfort. I realize a lot of the times I don't want her to be uncomfortable because I don't want to be uncomfortable.
Has this caused?
Shopping, food. I've kind of in my mind, because she's a heavy girl, I've always wanted to shield her, and I was her buffer, and I was going to be the buffer from the world and protect her. And as a result of that, I played a role of God, I guess. And that's not appropriate. And I kept expecting her to get it, but I've never let her to get an opportunity to learn it.
The goal is that there is no goal. It's always ongoing. There's never really a true end. It's just kind of increasing and improving some coping strategies. That's my thing about it. And what we're looking at is how the coping strategies that Felicia has used in her life, how she's used them and how her daughter has learned them as well, and how they're impacting her daughter's life. To comfort her daughter, to make her daughter feel okay, she has not used the word fat for a long time.
Yes.
She's minimized some things that are danger for her daughter. Whether it's the weight, whether it could be drugs, whatever it could be. Sometimes we minimize the ugly to comfort our kid. And we minimize it because we want to protect our child. And that becomes kind of like somewhat of what we're talking about with Felicia. Her coping strategy has been to make everything okay. And
kind of avoid it.
And avoid it. And Simone, her daughter, has such this child has she feels so strong about herself. She's so confident, or she can portray a sense of confidence that is amazing. But inside there is some true pain, and she taps into it. But then it becomes too hard to tap into it, because if I tap into it, I may have to do something about it, and that's hard to do. So I go back with that confidence. Mom has fed her that confidence, because Mom's fear was, I don't want the world to kick her butt. Baby girl's in college now. The world's going to kick her butt. And so now she's there, and she's getting her butt kicked, not just because she's a student academically, but because she's trying to feel herself in this world without the shelter of her mom telling her it's okay.